Hello YouTube. It is World Ovarian Cancer Awareness Day, and I just wanted to share some of the signs and symptoms I was experiencing prior to knowing that I had ovarian cancer. As you know, if you've been following this channel, I had colitis prior to being diagnosed with ovarian cancer, and so some of my signs were actually masked by the colitis because they were actually very similar, which is why they call it a silent killer, ovarian cancer, because it's so vague. And I mean, a lot of cancers are, but it's so vague, like you can easily write it off as something else. So what I was experiencing now, looking in hindsight, was I had some back pain, some lower back pain. It was more like pressure, but again, I also experienced that with colitis. My joints were often hurting and feeling achy. In CrossFit, we jump rope. I did leak urine, and I was thinking, well, that's strange, because I thought that was a sign of someone that had had a baby before, and I had never had a baby. So I was like, maybe it's just like getting older, because I had just turned 38, and like, maybe it's not just women that had babies. Maybe it's just a sign of getting older, like weaker muscles or something. But I was leaking urine when I was jumping. And we don't jump rope every day in CrossFit, so it's kind of like when I did jump, I was like, oh, I think I peed maybe a little. And then what else? There was a time when I stopped getting hungry, and I was like, that's so weird. I'm always hungry. I always want to eat, ready to eat. And I was just like, not that hungry. And so I thought that is a sign, not being hungry or getting full really fast. That was a sign. I had an irregular kind of menstrual cycle, but again, because of colitis, I actually lost my menstrual cycle for about 3 months. And I had one menstrual cycle prior to knowing that I had ovarian cancer. So I thought that irregularity was just part of me coming back, on track after losing it from having colitis and being so severely ill. But what happened was that my menstrual cycle came a week too early, and I've had irregularities in the past, so it wasn't like super alarming to me that it came a week early, but it came a week early, and then it lasted for 2 whole weeks. It was like 14 days. It was very strange. And then I was using a menstrual cup, if you've ever heard of those before. I think they're fantastic. If I was still having a period, I would keep using it. It's economical. I feel like it feels cleaner to me or whatever, but here or there. But anyways, you put this cup in and you're supposed to be able to seal it, but mine kept leaking. And I was like, what the heck? Like, it's not leaking. So I had to go buy tampons for the first time in years. And I thought that was very strange. But later I found the mass while I was on that very long period. But there was also bowel irregularities, so I thought I was having a relapse of my colitis and that it had come back because I was having bowel urgency. And I was like, maybe it's dairy because I reintroduced dairy or something like that. I was like, I don't know, and it just wouldn't stop. Like, I was having this urgency running to the bathroom. I'm thinking, oh, it's colitis, like acting up again. Well, later I'll find out, I had a tumor in my colon, and that's probably what was going on. So bowel irregularities would be another one. And then as far as the menstrual irregularity, I mean, it's kind of somewhat obvious because I had 2 giant tumors on my ovaries. But also, when I finally went into the oncologist, and they wanted to see my cervix, or they wanted to try to enter the cervix and get some endometrium to see if it was endometriosis, they couldn't access my cervix because it was so crowded in my abdomen that the pathway to the cervix was basically cut off. They were not allowed, they couldn't get in. And so that's how large the tumors were. They were just shifting my anatomy, and they had grown so fast. So those are the signs that I experienced that I pushed off as another issue that I had. And it's very easy to do, as you heard through what I just said. How many of you have ever experienced any of those things? You probably would just be like, oh, it's fine, it's fine, it's fine. It's just this little thing, it's just this little thing. Because it's not big things. The only big thing was me running to the bathroom. But after I had basically not done that anymore, I had basically, cured that situation. Now I'm running to the bathroom again because of diarrhea. And I'm like, well, I guess I'm not done with colitis now. So all of those were signs of ovarian cancer that can be easily pushed off as something else. So keep that in mind. What can you do to help yourself? Well, if you have breast cancer and you know it runs in your family, get BRCA tested. I don't care how old the people are, what age they got it, because when I was young, probably in my young 20s, I had a gynecologist ask me if anybody in my family had breast cancer, and it was my grandmother, but she was greater than 60 years old, to my knowledge, when she had breast cancer, and she had one breast removed, and they were like, you're cured, and it was 5 years later, and then all of a sudden she got breast cancer in the other side, and then she had that side removed as well. But the gynecologist didn't push to have me tested for BRCA gene. And as far as I know, my grandmother probably didn't have the BRCA gene. It was probably related to something else like lifestyle, because they were heavy smokers most of their life. Because I recently found out my mom, she got tested for BRCA gene. She doesn't have it, and that was my grandmother was my mother's mother. So for me, this means it was paternal. I can't have my paternal test. That's not a part of my life, but that's the only other solution, is that it came from the paternal side as opposed to my maternal side. Had that gynecologist pushed me to get the BRCA gene tested at that time, who knows what would have happened. I was young, I was in my early 20s, like before 25 years old, so not really thinking about those kind of things back then, and I'm thinking that's not going to happen, we're invincible, etc. So it's just, if you have some breast cancer in your family, go get it checked out. I met someone else that the BRCA gene came from the paternal side, and she was the only female in the family, and that's why nobody got breast cancer, because they were all men, and it's a lower risk for breast cancer. They still can get it, but they weren't showing breast cancer, so they weren't thinking BRCA gene on that side of her family. So that's just something that you can do. Otherwise, there's really no good screening for it. There's no blood test other than, the only thing you can do is check and see if you have the BRCA gene. That's pretty much it. And know what the signs and the warning signs are of it. That's really all you can do. That's why it's the silent killer. The one that I had was very fast growing. It's clear cell ovarian cancer. That's all I can remember. High grade clear cell carcinoma. That's what it is. High grade clear cell epithelial ovarian cancer, and that is very fast growing, and that's why it's a silent killer, because by the time you even realize that you have it, it's pretty much done its damage. And I caught it at stage 3B, which, I caught it, which was pretty incredible. When I first caught it, I had that little bump down to the right of my pubic bone. That was the right ovary. By the time I had my surgery, that little bump had moved up towards my belly button, and it was bulging out of my body when I would lay down flat. I mean, that was over the course of like 4 to 6 weeks. In 4 to 6 weeks, it went from that little bump to like this huge thing in my body. Unreal. It's so fast. So yeah, if you have any of those signs, I don't know that I would just discount them. I mean, having been through what I've been through, I wouldn't just push it aside. What am I doing right now? Well, I'm in my car. I just got out of pelvic floor physical therapy, and I'm super excited. She did her assessment today. My coccyx is like completely twisted to the right side, And what is it throwing off? It's throwing off like severe tightness in a lot of the muscles on the right side of my hip and in my pelvis and in my pelvic floor. And that's not allowing me to use the bathroom properly. And I have to like retrain my bowel and my bowel habits, and work on these tight muscles. Number one, to try to get the coccyx back to center, but also just to learn how to go to the bathroom again. I was talking to my therapist and I'm thinking, you know, I told you before I had ovarian cancer that I had colitis. I was running to the bathroom, you know, like 12 times a day, and you're constantly clenching. And so I basically trained myself to be very tense. And then the surgery and all the scarring and all the swelling and just threw everything off and made it worse. But I need to relearn how to not be so tense. And, you know, they do these little tests and like, here, contract and relax immediately. And it's like, I can contract. And then it's like this. Am I relaxing? I don't know what's going on. Like, imagine like being like surprised and you just can't let your eyebrows back down. You know, you should just be able to go, you know, and it's like, you know, it's like they don't know what to do. Like the muscles don't know what to do anymore. So, I mean, I had a good couple of successful releases, which she said is great because that means my body can do it. We just have to reinforce that sequence of events, that coordination of relaxation. It's amazing. You guys, if you like having any issues with bowel or bladder, and I mean men too, I'm not talking about just women, but if you have bowel or bladder issues, painful sex, things like that, just go get it checked out, go get assessed. Maybe you can, or leaking urine, you can be severely constipated, or maybe you have diarrhea, or you can't control your bowel. Maybe you're having accidents all the time, whatever. Go get it checked out. It could just be like a muscle coordination issue, developed from who knows when. A lot of times with women, I can't speak for men. I don't know how it presents in men or what brings it on, but pregnancy for women, if they've had C-sections, I mean, everything gets really stretched out as you're growing that baby. As it gets through the birth canal, things can shift and, you know, strain and you know, you're pushing and all that stuff. And then any kind of abdominal surgery of any kind can cause this swelling and uncoordinated movements through your bowel and bladder. I really recommend it. I'm so hopeful. I haven't been this hopeful in a really long time. I've just basically been living with chronic pain for a couple years, and it's really, really difficult. Probably affects my mood, probably affects my energy level. It definitely impacts my sleep. And these are not things I want. You know, I want to be a positive, optimistic, energetic person. And I do my best. But, you know, human beings, the world gets to us sometimes, and our situations get to us sometimes, and we don't really have as much control over it as we'd like to all the time. So that's just what I wanted to give as an update today. It is World Ovarian Cancer Awareness Day. Those are the signs and symptoms I was experiencing that seemed masked by another illness. And yeah, I highly recommend pelvic floor physical therapy, getting it assessed if you're having any issues with bowel or bladder. All right, guys, take care of yourselves. Have a great one.